I will now turn it over to Dr. Erica Thompson.
Good morning, thank you. Thousands of Medicaid enrollees in Mississippi risk losing their coverage when the COVID-19 public health emergency ends. We're going to share with you ways we can minimize this risk of happening. Medicaid redeterminations have always been a source of coverage losses among Mississippi Medicaid beneficiaries. For several reasons, many people fail to respond or they don't respond on time. So these reasons include confusing paperwork. It could be the forms not reaching people because they may have moved. So several factors are coming together to make upcoming Medicaid eligibility determinations extraordinarily risky. Medicaid enrollment has grown during the pandemic. When the COVID-19 public health emergency ends, Mississippi will be tasked with addressing a significant backlog of pending renewals and redeterminations. This volume of pending actions is likely to place a heavy burden upon Mississippi Division of Medicaid workforce, and it may increase the risk of terminations of eligible individuals. Moving through the large numbers of redeterminations is a huge undertaking, made even more challenging because many of the recipients may have moved, lost their housing, or contact information may not be the same. As public health advocates, we need to be proactive and plan for and implement strategies to prevent unintended coverage losses. Continuous Medicaid enrollment has allowed people, including many people of color, to retain coverage and get needed health care during the pandemic. When the requirement ends, most people will likely continue to be eligible for either Medicaid or CHIP, but a massive number of renewals will test this system. So every level of government, the health sector, the community partners should help plan to ensure that the end of the public health emergency doesn't push thousands of Mississippians into the rank of the uninsured and create even greater health disparities. Now I would like to turn the meeting back over to Tamara, our moderator.
Thank you, Dr. Thompson. Your work to address complex public health issues related to community health, economic empowerment, and workforce development are vital in many communities your organization serves throughout Mississippi. It looks like one of our speakers is running a little bit late, so I'm just going to step ahead to our other speaker. So our next speaker is Carrie Abernathy, Senior Program Manager of Health Help Mississippi. Carrie joined the Mississippi Health Advocacy Program in 2002. Before joining the Mississippi Health Advocacy Program, Carrie worked for a local nonprofit doing fundraising, education, and outreach. She earned a bachelor's degree from the University of Southern Mississippi in speech communication.
Thank you, Tamara. As Tamara said, my name is Carrie Abernathy, a program manager with Health Help Mississippi. The Mississippi Health, there we go. The Mississippi Health Advocacy Program is really committed to improving health policies and practices here in Mississippi. Since its inception, MHAP has been an integral part in all major public health policies in Mississippi, from issues including Medicaid, CHIP, the Affordable Care Act, and consumer protection. MHAP has strived to amplify the community voice of health policy throughout Mississippi. MHAP's Consumer Assistance Program, Health Help Mississippi, assists Medicaid consumers by finding health coverage, understanding their health coverage, filing appeals and complaints related to Medicaid and CHIP enrollment, and assistance of course, with Medicaid redetermination, what we're talking about today. Health Help can assist beneficiaries with Medicaid redeterminations in this way. When beneficiaries receive renewal forms, they should clearly explain the additional information needed, indicate where and when it should be sent to finalize the redetermination process. When beneficiaries have questions, Health Help will be a resource to them to guide them through the process. If individuals are no longer eligible for Medicaid or CHIP, Health Help will explore other resources for alternative sources of coverage. Health Help contacted the Mississippi Division of Medicaid with the following questions. I will now share with you their responses, our questions and their responses. How will Mississippi Division of Medicaid, MDOM, that you will see referenced throughout this presentation, be sending out redetermination notices by mail, email, or both? Medicaid's response. Individuals whose eligibility cannot be redetermined using available electronic data sources will be issued a pre-populated renewal form by mail. Health Help asked, where should recipients proactively update NDOM on their most recent contact information? Medicaid responded with, address updates and other eligibility changes can be reported by telephone, mail, in person, or fax to the regional office that serves the individual's county of residence. Regional office phone, fax, and address information is located at medicaid.ms.gov/about/office-locations/. And we will include that in the chat feature so you can copy and paste that and use that for your own resources. Eligibility updates and changes can also be reported to the Office of Eligibility by telephone, toll-free at 800-421-2408. One of the questions that Health Help also asked was, where can recipients obtain the NDOM forms to proactively update their information? Medicaid's response was, for reporting updates and changes, see above. Well, see above references the Medicaid's response that can be found on slide 5. And we will also provide you with everyone's presentations at the conclusion of the webinar today. Health Help's question was, in general, how does Medicaid plan to be proactive in this process? Medicaid's response was, we are awaiting final guidance from CMS on ending the public health emergency, PHE, and otherwise are in the planning stage. The next question, how many redetermination notices will NDOM send out and what is the time frame? Medicaid's response, we are awaiting final guidance from CMS on redeterminations and timeframes at the end of the PHE, which stands for Public Health Emergency. Health Help also submitted these questions and the same response was given. Health Help's question was, has the NDOM explored and adopted communication strategies that ensure Mississippi Medicaid beneficiaries are provided accurate information and do not miss important information regarding their coverage, including requests for information? The next question was, has the NDOM considered extending deadlines for requests for information to ensure that beneficiaries have sufficient time and notice to respond? Medicaid's response, The Division of Medicaid is currently reviewing guidance from CMS on outreach, retention, and returning to normal operations. At the end of the PHE, the agency is in the planning stage and as such is considering various strategies for additional communication and outreach to recipients due for renewal, including those indicated in this request. Now, the next slide that you'll see details how beneficiaries can contact the Mississippi Division of Medicaid offices, either by phone, fax, or address information. And that information per the county that the beneficiary resides in can be found at medicaid.ms.gov/about/office-locations/. Eligibility updates and changes can also be reported to the Office of Eligibility by telephone, toll-free at 800-421-2408. Magnolia Medical Foundation is a host today and offered a valuable community perspective on Medicaid. If you would like to reach out to Dr. Thompson, please call 769-524-8002 or visit them on the web at www.magmedfound.org. The next slide that's on your screen details how beneficiaries can contact Health Help either by phone at 1-800-777-314-3843 or our website portal at healthhelpms.org. Again, our phone number is 1-877-314-3843 or on our website at www.healthhelpms.org. I would now like to turn the meeting back over to our moderator, Tamara Taylor. Thank you.
Thank you, Carrie. Next, I would like to introduce Garrett Hall, a policy analyst at Families USA. At Families USA, he provides policy analysis and research to advance Medicaid coverage access, health equity. Before joining Families USA, Hall worked at the Uninsured Project, a California health policy organization. He centered the uninsured, Medi-Cal, and health equity in the organization's efforts to convene stakeholders from across the state. Before ITUP, Hall completed a thesis predicting the potential impact of Medicaid work requirements on African Americans using a welfare reform analysis. Now you will hear from Garrett Hall.
Hey everyone, sorry it took a bit just to reload as a panelist. I hope you all can hear me now.
We can.
Okay, great. I'm just going to share my screen really quickly. Okay. And I hope you all can see that as well. And I apologize for being late, was actually just on a meeting with CMS talking about this issue and their plans for the upcoming year. But we can definitely get into that as we go through the presentation. And so we'll be talking about the unwinding of the public health emergency and how that relates to Mississippi and Mississippians on Medicaid. Just for a brief background, Families USA is a national voice for healthcare consumers dedicated to high quality, affordable healthcare and improved health for all. And so we do public policy analysis, advocacy, and we collaborate with national and state partners like yourselves. And just to guide our discussion today, and as you may have heard previously today, want to talk through framing the redetermination's potential impact, just some brief historical context to this maintenance of effort, and then recent CMS recommendations and how specifically to the state of Mississippi advocates and clinics. And then I think there will be time for a Q&A at the end. And so for potential impact, the best framing is that we are looking at potentially the largest Medicaid losses in the history of the program, and we really need your help. This is where all of your work on the ground is going to come in. If we are able to get through this with less Medicaid losses, it will be because of the work that you all do. And so for the potential impact in Mississippi, the state had almost 800,000 people relying on Medicaid for their health coverage in October of this year. And there could be a disproportionate potential impact on Black Mississippians and other people of color, because we know from 2019, which is some of the latest data that we have, because the pandemic impacted our ability to collect some of the data. In 2019, Black Mississippians were 59% of the Medicaid rolls. So you can see how that would be disproportionately impacted if there's large losses. And just for some other state examples as to how this has played out, last year, the Trump administration gave Utah permission to end its maintenance of effort requirement for kids on CHIP. And the way that Utah did this redetermination is it resulted in 40% of kids losing their health coverage, but only 15% of those kids were ineligible. The other 25% were terminated because people didn't respond to those state notices. And kind of similarly in Louisiana, 85% of Medicaid terminations occurred not because people were ineligible, but because they weren't able to respond to state notices. And as you all likely know, when there's these really high numbers of people not responding, that's not a individual behavioral issue, individual level problem. It's a systemic issue with how we are doing the process. And so for this historical context of this current maintenance of effort, in the Families First Coronavirus Response Act, which passed in early 2020, the bill provides states with a 6% bump in the federal matching rate to help states with the economic crisis, budgetary impacts, help the states maintain their Medicaid rolls. And in return, they had to maintain their Medicaid rolls. They had to have that continuous coverage through maintenance of effort or maintenance of eligibility requirements is what it's called. And they couldn't impose stricter eligibility throughout the duration of the public health emergency. And so during that time, Medicaid enrollment increased 10 million nationally, and it's a record total of over 81 million now. It's 82, 83, something like that. And then in August of this year, the Biden administration's CMS released a state health official letter that kind of updated guidance that the previous administration had put out. And so this new Biden administration letter said that states have 12 months after the end of the public health emergency to complete those redeterminations. There's an increase of 6 months from the previous administration's guidance on this. And states could, during the public health emergency, can still process redetermination paperwork. They just can't take action on it. And so for any person that the state finds, that Mississippi would find ineligible for Medicaid, they, with this Biden administration letter in August, they have to complete an additional redetermination for that individual if they were deemed ineligible previously. So you can't just assume that the circumstances they had during the public health emergency will continue after that emergency is over. And then this is the latest information we have, and I just heard it again in the meeting I had with CMS before this. We're hearing that additional guidance is in the works. They're trying to figure out timing on when it will be released. There's not a lot of indications of what will be included, but it will go for it will or should go further than what this letter in August did. And so we're really eager to see what that language is. And then other than waiting for that latest guidance, the current status of this kind of lies with the Build Back Better Act, which has, as you know, has passed the House. It's being considered by the Senate now. It could reach the Senate floor next week at some point, but we hear it may take up until like the holiday break for it to pass. It could potentially go till January. There's a lot of uncertainty on timing, but that's kind of where it's at. And what it does have language on the end of the public health emergency in it, and it decouples those redeterminations from the emergency. And that's because the emergency could go through June 22 or longer. And because there's uncertainty of when it will end, there's been a lot of additional uncertainty of how to plan for all of these redeterminations. It's just not possible when states don't have a timeline. And so the language says that redeterminations can begin in April of 22, which is soon given when the bill might pass, but it does provide that certainty of when this process will need to ramp up. And then it also says that increased FMAP will gradually decline between April and September, which is better than how it is currently when the public health emergency ends, because that money would just kind of drop off a month after the emergency ends. So at least there's some leeway as we go through next year. And then its additional guidance was states should not process more than 1/12 of their Medicaid rolls in any given month, basically saying the Biden administration says states should take 12 months to do this. You should really take that 12 months to do this so that it's not rushed, so that you make sure it's accurate. And so that's the language that's currently in the act. Now, CMS did recently release recommendations, and this happened actually at the end of November. And there's a publication which is linked at the end of this presentation titled "Strategies States and the U.S. Territories Can Adopt to Maintain Coverage." And it has this checklist of topics that you can see here. There's a lot of recommendations in it. They're not requirements, which is something that we would like to see as CMS to come out with. Here are definite requirements that states must meet. These are recommendations, but it's pretty comprehensive between all of these topics, and they note which they think will have the biggest impact. And so I'll go over some of those and how it relates to the work that you all are specifically doing on what Mississippi should be doing to prepare and what you all can do. And so the state of Mississippi, here are some of the recommendations CMS has. The state should increase the percentage of ex parte renewals completed. So ex parte, just so we're all on the same page, is renewals that are done automatically by looking at other data sources that like confirm Medicaid eligibility. And so one recommendation is expand the number and types of data sources used. So like IRS, wage, unemployment, or SNAP data. SNAP data, for example, has we know that it's very correlated to Medicaid eligibility. So that's something that could be used. The state should streamline renewals that can be completed through the ex parte process. And so like ensure that individuals can submit info through multiple methods. I did see that Mississippi responded to a question on that, and they include all of those methods except for an online option. So something to push the state on potentially is making sure that people can submit their information online, because that could be the easiest way to update like contact information. And the state should ensure renewal forms are pre-populated so that there's less confusion, so that people can fill it out easily. And Mississippi did respond that this will occur, but this is also just federal law. So something that they do actually have to do. The state should implement processes to prevent and address returned mail. And this is something we are very concerned about because people have moved a lot during the pandemic, because as we saw in Utah and in Louisiana, it's returning notices and filling them out is a barrier to people maintaining coverage. It's a burden, and like if my health insurance was dependent on that, it would be hard to maintain. I think that goes for many people. And so requiring managed care plans to seek updated mailing addresses and share info with the state, ensure consumer notices and other electronic and phone communications and renewal forms remind consumers to update their contact information. It's one of the most significant things that can be done. The state should ensure accounts are seamlessly transferred to the marketplace if someone is found ineligible for Medicaid. The state should adopt 12 months continuous eligibility, 12 months postpartum coverage. That's also part of the Build Back Better Act. Reduce or eliminate the periodic data checks that do kick people off. And so as your role as advocates, those are things that you can push the state on. Direct managed care plans to conduct outreach and provide support to individuals that will be going through these redeterminations. And the state should share a list of individuals up for the renewals or the redeterminations in the coming months with the managed care plans so they know who to provide outreach to. And so for community-based organizations, consumer advocates, navigators, et cetera, like yourselves, here are some other recommendations that you could specifically work on or urge the state to do. And they are implement processes to prevent those return to mail. And so conducting outreach to remind individuals to update their contact info, revise any consumer notice language, anything that you're putting out to the public to ensure it's communicated in very plain language and clearly explains the appeals process. And this is because this is a really complex topic. It's been like 2-ish years since people may have received their notices last. And as people lose coverage, that appeals process will be important to make sure that they can get back on their Medicaid. And then conduct intensive outreach via multiple modalities to make sure people can update their contact info, like using a text messaging program to communicate quickly with people, and then communicate effectively with people who have limited English proficiency, they're living with a disability, and these are also something that the state should do. So review language access plans, ensure documents are translated into multiple languages and are culturally competent. And I know that Mississippi responded that language assisted services are available. It's just making sure that while available, people are also easily able to access them. Review and enhance availability of oral interpreters, update websites with taglines in non-English languages, and ensure info is communicated to people with disabilities, accessibly providing auxiliary services at no cost. So that's like Braille services, large fonts on websites, things like that. And then revise call center or broker scripts to include requests for that updated contact info. And then combine vaccine and enrollment outreach. We've seen a lot of success in other states on this, not as of yet related to redeterminations, but just in terms of increasing Medicaid enrollments, for example, as people are coming in for vaccines or boosters, that they're provided with information on how to enroll, provided information on how to update their contact information and what's coming up in the redeterminations in this next year. And then for clinics and providers, similar recommendations of implement processes to prevent returned mail. So conducting that outreach so people update their contact info, incorporating eligibility reminders and requests for additional information into appointment reminders. So if you send out appointment reminders via phone call or text message, I know some clinics are able to do those things, including information on this in those messages so that people are aware of what's happening. And then again, combining that vaccine and enrollment outreach, especially as we have new variants. I know the demand for vaccines and boosters has increased, so that could be a great opportunity. And then just want to end with some just highlighting the specific calls to action and kind of bookend the beginning of the presentation with that we're looking at the biggest potential losses in Medicaid coverage in history of the program, and it really will be your work on the ground that helps to prevent that. So conducting as much intensive outreach as possible and as many modalities as possible to explain the process and helping people update their contact information so they can receive those notices. Making sure outreach is in plain language, culturally competent, and accessible to people with limited English proficiency or people with disabilities. Contacting the Mississippi Division of Medicaid to urge the state to proactively implement CMS's recommendations, including that 12-month timeline to process everybody. I know the state is waiting more guidance from CMS, so making sure that they're aware of what's coming and what those recommendations are. And then really please flag for us anything that you hear or see happening on the ground, because we definitely would appreciate knowing, and we can communicate with CMS anything that we hear from you all, what's happening on the ground, and kind of be the liaison between you all and Medicaid beneficiaries and CMS, so that they are aware of how states are processing and redetermining people. And just want to highlight that there are some resources here at the end of the presentation, which I'm sure will be sent around. One thing that CMS did just release yesterday, as you can see, is a overview. It's called Overview of Strategic Approach to Engaging Managed Care Plans. So that's linked here, and something that I would encourage you all to go through. But I appreciate all of your time, and if there's any questions, I'd love to help answer them.
Thank you, Garrett. So we'll pause to check the chat and Facebook to see if we have any questions. We don't have any questions at this time, but both presentations will be available to all participants who registered for today's meeting. Thank you to all of our presenters today, and thank you for attending this meeting. Just to recap, thousands of Medicaid enrollees in Mississippi risk losing their coverage when the COVID-19 public health emergency ends. When beneficiaries have questions, Health Help will be a resource to them and guide them through the process. If individuals are no longer eligible for Medicaid or CHIP, Health Help will explore other resources for alternative sources of coverage. Beneficiaries can contact Health Help either by phone at 1-877-314-3843 or through the website portal healthhelpms.org to receive assistance. This concludes today's meeting. I want to thank Dr. Erica Thompson with Magnolia Medical Foundation for being a host today. If you would like to reach Dr. Thompson, please call at 769-524-8002. Please enjoy the rest of your day. Bye-bye.